Hello everyone, welcome back. So today let's discuss a rather easy topic, that is cerebellum. So moving on to question 136. During work, a patient gets tired quickly in upright position with closed eyes. He staggers, loses balance. The tone of muscle is reduced. Which structure of the brain is most injured most probably? So let's talk about cerebellum. First of all, we'll see its structure. This is a mid-sagittal section showing the inner structure of cerebellum. It is divided into an anterior lobe and a posterior lobe, which are divided by a primary fissure and also a flocculonodular lobe. We can also look at, let's look at this picture. This is the posterior view of cerebellum and it is not dissected. So in posterior lobe also you can see the anterior lobe, the posterior lobe, which is divided by the primary fissure, and also the flocculonodular lobe. So again, the flocculonodular lobe consists of a flocculus and a nodulus. So anyways, when we see the cerebellum from the posterior view, we can see a longitudinal depression. So the most midline structure of cerebellum, it is called the vermis, and the rest is called the hemisphere or the lateral hemisphere. And just adjacent to vermis, for example, in this area is the intermediate zone. So again, let's see the flocculonodular lobe. It is called the archicerebellum. That is the oldest. And the anterior lobe is called the paleocerebellum, and the posterior lobe is the neocerebellum. And if we look at from the posterior view, we can divide it into vermis, flocculonodular lobe, and hemisphere. The vermis area is called the spinocerebellum, the flocculonodular lobe, again the vestibulocerebellum. Why vestibular? Because here the vestibulospinal tract come and communicate with the cerebellum. And flocculonodular lobe hemisphere. Hemispheres are also called the cerebrocerebellum. Why? Because the cerebral cortex communicates with cerebellar cortex of the lateral hemispheres. So that's why it is called the cerebrocerebellum. Now let's also write down the functions. So the flocculonodular lobe is mainly for the balance, maintain the balance of the body. Anterior lobe is for the crude movements. And the neocerebellum is for the highly skilled voluntary movements. But this classification kind of is not very useful these days. Mostly they are asked from mostly these days the questions are asked from this classification of the parts of cerebellum. So vermis, flocculonodular lobe again is for the balance, for maintaining the balance of the body. The vermis area is for controlling the muscles of trunk. And the hemispheres, they are responsible for along with cerebrum, they are responsible for the sequential movement of limbs. Sequential movement of the limbs. So again, the flocculonodular lobe, that is the oldest one, the vestibular, also called the archicerebellum, the oldest one, or the vestibulocerebellum. It is for the balance, for maintaining the balance of the body. Anterior lobe, posterior lobe, don't use this classification, mainly use the spinocerebellum, that is the vermis. It is for maintaining the it is responsible for the muscles of the trunk or the axial musculature, the trunk, shoulders, and hips. Thus, hemispheres, the lateral hemisphere, also called the cerebrocerebellum, they with the along with cerebrum, they help in planning the sequential movements. So what is it that the cerebrum, before initiating the movement, has to contact or communicate with the cerebellum first, because the cerebellum receives all the proprioception from the muscles. Proprioception means that you know where your body part is right now. For example, even if you close your eyes, you know your hand is here, and even if you close your eyes, you can like touch your fingers because you know where their position is. So that is called proprioception, and the proprioception is received by the cerebellum. For example, if I have to move my hand, if I have to hold this pen from my desk, first of all, I should know where is my current position of my hand. So that is by cerebellum. In this way, the cerebellum communicates with cerebrum. And then when cerebrum has to initiate a movement, it again communicates with cerebellum. So in this way, there's a proper sequence of movements, and so the cerebrum communicates with what part of cerebellum? The hemispheres. In what? In planning the sequence, in planning the movements. That was just a basic function of cerebellum. The most important function of cerebellum is actually the coordination of the body parts. We can also look at the function of cerebellum by looking at the symptoms which are there in cerebellum degeneration or cerebellum injury. So in lesions to the vermal region, I told you that the vermal region was responsible for the balance. And so if this region is damaged or injured, there will be disequilibrium or gait ataxia, because the person cannot keep balance and he walks in a strange way. Next, lesions that include the hemisphere. Again, the ataxia, that is problem in movements, hypotonia. So from this, you can say that cerebellum is also responsible for maintaining the tone of muscles. So this is an important one. Next is intention tremor. So intention means the tremor is not present at rest. It is only when you are intending to move something. For example, again, if I have to pick up my pen to move my hand, only when I'm trying to move, the tremor is seen. It is not seen when the hand is at rest. So why intention tremor? Again, I told you that to plan a movement or the sequence of movements, the cerebrum first has to contact or communicate with the cerebellum to know the current position of the hand, and then to move it to the next position. So again, if the cerebellum is damaged, the intention tremor is seen, and the rest tremor is seen in the Parkinson's disease. So very important distinguishing point. If in the question there's given tremor is at the rest, the answer will be Parkinson's disease. And if they're saying the intention tremor, you should always think of cerebellum. The next is asynergy. That is loss of coordination of movements. This is the most important function of cerebellum, that is to coordinate the muscle movements. Next, dysmetria, past pointing. For example, they have mentioned here finger to nose testing, finger to nose testing. Even if I close my eyes, I know where my finger is. Even if I keep it here, I know where my finger is, and I can touch my nose and finger back and forth. But if my cerebellum is damaged, I don't know where my muscle is. Why? Because there is no proprioception. I don't know where is my position. If I close my eyes, I don't know where my hand will be, and I will not be able to touch my finger. So that is dysmetria or past pointing, and the patient has difficulty performing the finger to nose test. Then again, dysdiadochokinesia or adiadochokinesia, that person cannot perform alternating movements. For example, the pronation or supination of arm. Even if I close my hand, I can perform this very easily. Why? Because my cerebellum is functioning. Next, scanning dysarthria. The person with cerebellum injury also has problems with speech. We can see staccato speech here. in patients with cerebellum injury. Next is gaze dysfunction, or a nystagmus may be present because cerebellum also coordinates the eye movements. So if the cerebellum is damaged, the nystagmus can be seen. So that was a quick review about the functions of the cerebellum and the symptoms which are seen in the cerebellum injury. So let's go back to that question. So in the upright position with closed eyes, he staggers. That is, he cannot maintain his balance. He does not receive his proprioception. He doesn't know how to coordinate his movements. Also, the muscle tone is reduced. So all these are pointing towards the cerebellum injury. Let us also look at some other questions. So in this, after removal of a part of CNS, the patient developed atony, ataxia. That is, a patient cannot maintain balance. He has problem with walking. Intention tremor, the most important one. Ataxia and adiadochokinesis. Again, the patient cannot perform alternating movements. So the answer is cerebellum. Next, a patient with injury sustained to part of central nervous system demonstrate disrupted coordination and movement amplitude. Muscle tremor during volitional movement. That is when a person is intended to perform a movement, for example, picking up a pen. Then the muscle tremor is seen. It is not seen at rest. Next, poor muscle tone, hypotonia. The answer again is cerebellum. Another a few extra points about cerebellum, that it is present in the posterior cranial fossa. That is, it is present in the posterior cranial fossa, and it is separated from the cerebral cortex. It is separated from the cerebrum by what part of dura mater? The tentorium cerebelli. This is a previous year question. It was asked in Krok. By what part of dura mater? The tentorium cerebelli. So that was a quick review of cerebellum and all the questions that were asked in Krok, or mainly you just have to remember all the functions and all the symptoms that are seen in cerebellar injury. And that's it for this video, guys.